At the heart of Bronx Community Health Network's health and wellness programs is a deep respect for the diverse cultures, resourcefulness, and tenacity of 1.4 million Bronx residents. We at BCHN are committed to empowering individuals and families to make and maintain healthy life choices. Through public and community partnerships and community engagement, we harness the strengths of Bronx residents.
Health doesn't necessarily start in the health center. Health starts where we spend most of our time. So that is homes, at school, the workplace, the places where we go and worship. Our community health workers are representative of the community we serve. They speak the language, but they're also representative of the very rich cultural diversity that exists in the Bronx. They are kind of our presence in the community, and with them in the community, we're able to connect people to social services, to address food insecurity, benefits, employment, and many other services that people in the community need.
So community health workers are really key members of pretty much any multidisciplinary patient care team. Adding community health workers to the healthcare team really helps patients access the social and medical services that they need, and helps the system itself become more culturally appropriate to the people that they need to serve.
Patients come to me looking for assistance with housing, extra money for food, ways to pay their medications, and help with childcare. I work closely with social workers, doctors, nurses, and health educators. It's a team effort to help patients have a fair opportunity to live long and healthy lives.
We are now able to address a wide range of community needs. Our community is very complex here in the Bronx. We have new immigrants, older immigrants, we have working poor, working class, we have homeless individuals, all who come with a wide range of complex issues. So when we have a CHW working here with us, we're able to actually have an individual who can work one-on-one with our patients. And this is essential when navigating social services, government services.
About 1/3 of Bronx residents live with one or more chronic illnesses: obesity, diabetes, hypertension, asthma. These are compounded by low incomes, inadequate access to quality food, shelter, and safe physical activity spaces. Our community health workers are integral members of health center patient care teams, helping patients navigate complex social and healthcare systems. They're essential bridges, linking traditional and non-traditional care models, connecting the academic medical center environment with a wide array of community social support services, helping Bronx residents live healthy, productive lives.
I think initially several of us were a little skeptical about what a non-licensed person could provide to the healthcare team. But once they started finding and providing these resources to the patients, I think it really showed us what they could do both within the healthcare system and out in the community, and that's really where the rubber met the road. You know, in the end, the most important part of this is that they're helping patients' lives.
We started in 2015 with 4 community health workers. Today we have a team of 18 community health workers working at 10 community health centers throughout the Bronx. Over 126,000 patients have now access to a community health worker who's able to connect them to resources and services and all of that to improve their health.
So the integration of multidisciplinary teams with community health workers has been an essential element that's allowed us to achieve what we're trying to accomplish at the Montefiore Medical Group. It's not something that's specific to the medical group. Community health workers can be used in almost any primary care setting. And the way we've managed to do it is to use them for specific purposes that allow us to achieve certain goals. Number one, it allows our providers to spend more time in clinical conversation with their patients. Number two, it's a very cost-effective way of addressing the social and economic concerns that patients come to us with. It allows us to connect them with community-sponsored organizations, and it allows us to directly address issues that they come to us with. And three, it allows all of the other members of the team to work at the top of their license. So altogether what this does is it permits us to achieve a closer approximation of what we call the triple aim: better health care, better outcomes at a lower cost.